My name is Christopher Whaley. I'm a health economist and an associate professor of health policy at the Brown University School of Public Health. The focus of my remarks today is about the U.S. hospital industry, and in particular, nonprofit hospitals. I first want to acknowledge the importance of access to high-quality and affordable health care for all Americans and the important role hospitals play. Hospitals deliver life-saving care that makes us all healthier and improves our well-being. Hospitals are also a key source of employment. The U.S. hospital sector is among the largest in the economy and alone accounts for over $1.5 trillion in economic activity. Hospital markets in the United States have two key distinct features. First, the U.S. healthcare or hospital sector has experienced decades of unchecked consolidation. Nearly all U.S. hospital markets lack sufficient competition. As a result, the prices that hospitals charge the 160 million Americans with employer-sponsored insurance are high and variable and have little to no link to quality and are not explained by cost shifting. Hospitals currently charge patients prices that average 250% of what Medicare pays. Rising hospital prices do not improve quality and strain affordability for patients, employers, and taxpayers. Second, over half of U.S. hospitals are nonprofit. While nonprofit hospitals play a critical role in providing patient care and employment to healthcare professionals, the total financial value of nonprofit tax exemptions exceed $37 billion per year. In return for tax exemption, the IRS requires that nonprofit hospitals be organized and operated with the purpose of primarily benefiting the community. Yet, this does not always appear to be the case. While hospitals do provide community benefit spendings, some estimates value the tax exemption exceeds community benefit spending by over $25 billion per year. This discrepancy has led to bipartisan efforts to increase oversight of tax-exempt hospitals and to further regulate their financial assistance and debt collection practices. As I highlight in my written testimony, tax-exempt hospitals charge prices, provide levels of care quality and charity care that are similar to for-profit hospitals. Yet, the substantial financial advantage of tax-exempt hospitals has led to concerns that quality should actually be higher. If community investment is not larger and quality is not superior, then where are the extra dollars from these financial advantages going? As I again detail in my written testimony, I am concerned that the financial resources may be used in ways that do not directly improve patient care, including increased executive compensation, investment vehicles and account, which collectively exceed $1.5 trillion in value, and marketing, including sponsoring stadiums and sports teams. To address these concerns, Congress could consider several policy reforms. First, high and rapidly rising prices, which differ enormously from one hospital to another, but not related to quality or cost, combined with substantial investment accounts, may create the perception that some tax-exempt hospitals are operating with a profit motive. To ensure that tax-exempt hospitals fulfill their charitable mission, Congress could define standards for financial assistance and benefits to the community health sector. Second, to more broadly ensure that U.S. healthcare markets deliver high quality and affordable care, Congress and federal regulators could consider policies that prevent harmful consolidation in both the provider and insurance systems. This includes strengthening antitrust scrutiny, expanding site-neutral payment policies, and banning anti-competitive contract terms. States as diverse as Indiana and Vermont have elected to directly limit hospital prices. Third, to address concerns that 340B rebate dollars are not directly benefiting patients, Congress could ensure that improved transparency on each hospital's 340B benefit, narrow 340B eligibility, or extend 340B discounts directly to patients to improve their ability to access affordable care. Finally, Congress can also consider codifying and standardizing existing price transparency policies and ensure that hospitals report required rates accurately and in a timely manner. In conclusion, Congress can help ensure that the substantial tax benefits nonprofit hospitals receive translate into tangible improvements for patients and communities.